a large underserved and global health presence as well. We also have a dedicated scholarly block, sometimes during your second or third year, that everyone gets to take almost a full 4 weeks to work on a scholarly project. We're about 60-40 in terms of going into primary care and subspecialty care. So I think I've got most of our highlights there. Dr. Fielder, anything that you want to mention really quickly before we pass the baton on?
No, I think, thank you, Brian. That was fantastic. We are huge and we have fantastic faculty educators, and really, make sure that we are reviewing the curriculum every year to make sure we're focusing on education, to make sure that we're preparing you guys to train and to be competent in primary care. But this past year we had over 60% go into subspecialty fellowships and had a almost 97% match rate. So it's a pretty great group, and we prepare you for seeing very sick kids, very complex kids, high volume, high intensity, a lot of fun. Andrea Tatum is also on here in APD. Andrea, do you have anything else?
No big things to point out, but I put in the chat, if you're a foodie, we have great food here in Houston from all nationalities, and I'll be here to monitor in the chat if you all have any questions.
Okay, I guess it's my turn. If you don't mind, to go to the slide for Baylor Scott White. Thank you. So again, I'm Chris Hovland. I'm the program director in Temple, Texas. A lot of people don't necessarily know where Temple is. I like to say, if you know Chip and Joanna Gaines, or the Fixer Upper people in Waco, we're about 30 miles south of there. And that's the kind of the easiest way to find us on a map. I did all my, hopefully, I'm sorry, I'm having internet connection troubles. I've done all of my training here and stuck around now in my 7th year out, and really is a fantastic area to live in and train in. We focus on a small family-centered kind of a feel. And one of the ways that best kind of encompasses that kind of a feel is in our mission statement. And so our mission statement for our program is to transform medical students into skillful pediatricians who provide compassionate care for patients, families, and the community while retaining the joy in medicine and academic curiosity. Our program, I encourage you to check out our website to check out our aims that we have to uplift that mission statement. And I really want to focus on our residents as our resident-centered program. We really try and build the program entirely around them as best we can. And we seek their feedback in every portion of our program, from the good, the bad, the ugly, if you will, and really focus to improve as often and as best as we can. Our big focus for this upcoming academic year is feedback for our residents. We have, with our help of our fantastic program coordinator, Keziah Foster, developed some unique initiatives to really build on our resident feedback from all varieties that our residents work with, faculty, staff, and even patients. And so we're looking to hopefully have a fantastic project to present later in the year at APPD, maybe even. But our program has lots of fantastic curriculum initiatives. We are this year starting a half-day conference. We are in that conference integrating our leadership in medicine, evidence-based medicine series. We have a longitudinal QI curriculum. We also have procedural skills. We work into that and on our actual rotations with sim experiences. And we are also within that half-day conference focusing on our wellness initiatives as well. We have a mentor who meets with our residents once a month and is really available anytime outside of residency as well for our residents as needed, and is a great asset to our program. Our program also supports the community tremendously. Our advocacy initiatives, not just locally, but throughout the state as part of TPS and AAP nationally, we're proud to support. Locally in our community, our big focus is for our Feed My Sheep clinic, which is one of the only 2 children's freestanding clinics in the state, and that is completely free. And we operate that once a month, and our residents and faculty volunteer there. We are a somewhat small children's hospital, freestanding children's hospital. hospital, but growing by the minute. We're currently expanding many of our pediatric subspecialty areas and have fairly pretty much everything except for pediatric rheumatology and cardiothoracic surgery, which is our next focus to build is a cardiothoracic area in our program. We are also proud to state that we are in our second year of our 13 block curriculum, and that's been going really well with our residents. And the community is very comfortable, affordable living. Your average median cost of a house is about $165,000. And so I encourage you to check us out on our Twitter and on Instagram as well. We have a video all about our program. Please encourage you to go view that as well. For our resident, going roughly 60-40 into gen peds and pediatric subspecialty. Of those that match the subspecialty, we have a wide variety of subspecialty areas, and we are proud that this past year we had our first match into pediatric hospital medicine, and she's out in Lubbock, and so we're very excited for her as well. We have one fellowship program at our institution. It's Neonatology Fellowship. So if you're looking to do that, you can hang around and stay here for all 6 years. And we're very, very resident friendly, family focused feel. And I hope to answer questions if y'all have any. Thanks for giving me the time.
A question. Is your resident that matched here for fellowship Marissa Hammers? Yay.
Yes.
She is on service with my husband, who is a pediatric hospitalist here. So yay.
That's awesome. And we had, she just, I know how to, or she did, yeah, she's just had a baby. I don't know if we have time for questions in the chat or if we go back.
So maybe I can, do we want to go round robin again and maybe talk about, maybe one of you can pose a question and the three of us, like the three programs can answer? You want to do it that way?
I have a quick question that's kind of specific to Baylor, just because you guys have those like different tracks specifically about either primary care or about, you know, like education or global health. Do you have to know that coming in, or like at what point during your training do you decide on those tracks?
So when you decide to apply to our program, when you interview, you can apply to the categorical pediatric program, the global health program, the lead program, which is primarily underserved, and the physician scientist program. If you wanted to apply to all of those, if you already knew before you applied, if you interviewed with us and decided you want to change and add lead into the mix of where you want to rank, that's fine. But that will be the program that you match into for the 3 years. Global health is 4 years. The 4th year is a year in addition to your 3 years of pediatric training, where you will spend a year in either one of our underserved BPI sites or Baylor Pediatric AIDS Initiative sites in Africa for a year. But it doesn't count towards your requirements to sit for boards. So once you decide during the interview process, application and interview process, and you match into that program, then you're sort of in that program for the 3 years. Does that help?
Yes, thank you so much.
Sure. But for those that are applying to all of those, you can click all 3 of them unless you're a physician scientist, you usually want to do PSP if you are an MD PhD, but.
Can I ask a follow-up question to that as well? So if I did have global interests, global health interests, but did not apply for a global health track, would there still be opportunities to get into to that work?
Yeah. Brian, you want to talk? I don't want to take up all of the talk space, but Brian can tell you too.
Yes, and so what I was going to say is the opportunities that are available to the residents, that whether they're in those combined programs, those specialty programs, if you will, are readily available for our categorical residents. So any kind of lectures or seminars that they have, our categorical residents are invited to. And then when the world is not as crazy as it has been this past year, our categorical residents are often able to take a month away at one of our global sites. Unfortunately, over the past probably 12 to 18-ish months, we haven't been able to offer that, but hopefully starting sometime this year, we'll be able to go back to it. So I spent a month in Swaziland at the time, Eswatini now, working at one of the clinics. And so I was a categorical resident that was a part of any special track. So those opportunities are available. And then a lot of the opportunities are, for education and interests in those areas are available to anyone. So even if you don't apply to one of the specialty programs, you can still avail yourself of them.
And I would also add that our global health residents are back in Africa. They're full-time back to basics. Fingers crossed, we can get the pandemic slowed down and enough, and they don't have to come back like they had to in 2020. And I think we're gonna be able to send residents again starting January 2022. So very soon, yay.
I think your room's supposed to have a student moderator. Yeah.
Oh.
But in the absence of that, I'm happy to.
Oh, thanks, Becky.
Yeah. There's a great question about, we know that a number of Texas students end up matching in Texas programs, but what about out-of-state students or international medical graduates? And I wonder if we can hear each of the program's perspectives.
So I can start with that. One of our 7 residents for the past 3 years, if I look at the total residents here at the moment, roughly we have, I would say about 5 to 7% are IMG. All of those are US IMG, I guess. And we have probably similar amount that are out of state, maybe slightly higher. We do tend to attract more in-state, but every year we have someone from out of state usually.
In Lubbock at Texas Tech, we have about 1 to 3, sorry, I don't know how to do math in my head, but like 1 per year, so 1 out of 8 per year are IMG. And then out of state is probably 50-50, but we tend to get a lot of out of state med students come to our program when they're interested in doing like rural settings or community settings where they're going to be practicing like full spectrum pediatrics, because that still exists in some places. And so those are the kind of out of state people that we attract.
And Baylor? Elaine or Brian?
Yep. So I'm looking at our stats right now. So we have like 193 total residents. And this past year, I'm trying to get that, I think it was a little over half were from Texas. So we have pretty broad spread. We didn't have any IMGs match this year. Oh, actually we had 2, and if you consider all programs. But normally there's probably between 2 or 3 a year if you think about all of the programs combined.
Great. So I'm hearing that you can definitely apply whether you're in-state, out-of-state, IMG. And then the next question that got 2 thumbs up, which is, what is one thing that makes your program unique?
So I don't want to sound cheesy, but I already said it is our residents. I just love how involved they are in our program and how much they want to continue to transform it into the best that it can be.
And I'm going to say that it's the, one of our former chairmen used to say that we have accessible brilliance here at Texas Children's and at Baylor, because you can walk down the hallway at any given time and say, hey, how's it going, to, people like Peter Hotez and Sheldon Kaplan, who are renowned experts in their field, and are just an office away from yours. And you get a chance to interact with them, and they're they're humble leaders all around us to share their expertise. And I think with people who are such world-renowned experts, you would expect them to be very, stuffy and formal, and it's not like that at all. So I feel really blessed to be a part of that.
I would say that what makes our program unique is probably the supportive environment and a focus on a growth mindset. And I think our program director always likes to be more of a coach in life and in your professional career. So, and we just focus a lot on growth here. And I just think I stayed here, and I am not from West Texas just because I loved the atmosphere so much, that everyone was so supportive, from chairman and everyone down to all the support staff. So everyone wants to see everyone do well.
I love this. I want to go do residency again. All right. There's another great question about, can students get in, or can residents get involved with state organizations and patient advocacy? And is there protected time or other ways of supporting residents in this work?
Yeah, I think all of our programs support membership and active participation in TPS. I would say, just like we're the Southwest region, we mentioned at the beginning, Dr. Arandis did, we're very, very close, the same as with TPS. We're a very, very close functional unit with TPS and work very well with them. At our program, residents are allowed 5 educational days per year to attend conferences outside of their own personal vacation time, sick leave, etc.
Same here. I would just say, like, all of our programs are involved with TEACH, which I think Dr. Arandis had mentioned. And so I think anywhere you go in Texas, we're big on advocacy. It's just a really good region for that. All of our programs are gung-ho about it. So I think anywhere, any program you go to in Texas is going to be supportive of any advocacy projects and involvement that you're going to want to have.
Outstanding. Brian, did you want to?
I was going to, just reiterate that we support advocacy in the same way, and kind of we don't have a specific number of days, but conference attendance is counted as part of your expected duties. And so it's not even considered in your time off from a institution-wide policy. So it sounds like we're all pretty similar on that regard.
I love this emphasis on advocacy across the Texas programs, it sounds like. There's a great question about mentoring, a couple questions actually about mentoring. How do you help residents find mentors, and in what ways do you support residents in mentoring or career development?
I can start. So at Texas Tech, when you first come in as an intern, you're assigned one of the leadership members who kind of mentors you for that year. And then in the spring, when you kind of have more of an idea of what you want to do, you can pick your own mentor out of the faculty to kind of help with career. A lot of times they'll pick someone who's going to help them with their career fellowship goals. Sometimes it's just somebody that they mesh really well with and have the same life family goals. And so sometimes that's how mentors get picked, but the residents get to pick their mentors, and we can help find good mentors. Even if you haven't like met someone on those rotations yet, we get you hooked in early.
So in the spring each year, we after match occurs, we have our faculty members who are anyone interested in being a mentor submits kind of a little bit of information sheet about themselves, and we send those lists out to all of our newly matched interns and ask them to kind of pick who best fits with their personality and profile. And it can change at any point in time, but we honestly let our interns pick who they want to be their mentor.
We have this is an evolving part of the curriculum that we're actually going to work on this year, is the mentorship program. But when you come into residency at Baylor and at Texas Children's, you are assigned into a society. So a society is, because we do have so many residents, there's about 20-ish or so residents per society, and there are 4 or 5 faculty members that serve as faculty coaches and advisors over each society. So you're placed into sort of a little family whenever you come in. The resident coaches or the faculty coaches are there to help you understand milestones, to sort of get you plugged in as soon as you come in. And then after the first year, we help you identify a mentor that similarly, someone who has the same either clinical interest that you're interested in, or maybe they just have research project that you're working on with them. For a variety of reasons, I think mentors are important. And I have about 12 mentors total, honestly, and one of them does not serve the same role as the other, right? So I'm pediatric emergency medicine trained, and I have my PEM mentors that I have had for over a decade now. And I have my program mentors, my educator mentors. And then I have my friends who are moms, like I have 2 boys, and they serve as sort of my mom physician mentor, right? So it depends on what you need. And that is something that I think can make or break a mentoring pairing, make it successful. Because if there's a mismatch in what you are looking for and what the mentor can give, then I think it's just a person to check the box with and say, okay, I met with them, I did my part, and we want to make sure we're building a foundation and a scaffold of mentoring across the 3 years. So.
Thank you. I love that. I have many, many mentors too, and I'm forever grateful to them. Next question is, in what ways do you see your program growing, improving, or changing over the next few years?
I'll start in Lubbock. Our children's hospital is growing rapidly. And so a lot of our rotations that are at our university medical center are being moved over to our children's hospital. So as the volume's increasing and we're getting more specialists there, we're moving more to our freestanding children's hospital. One of the other big changes we had this past year is a new chairman. And so that's just a big change that happened that we like to tell people about.
So from a Baylor standpoint, we'll piggyback off that. We have a new chairman coming in October, so we'll have that change as well. So it's a fairly normal thing, not to like stress anyone out about it. I would say most chairmen in pediatrics are good, nice people anyway, so it doesn't make that huge of a difference. I think the areas that we're looking to improve are really the kind of balance between service and education that I think every program, and maybe the bigger programs more so than the smaller programs, have to deal with, is how do we we ensure you have access to all these fantastic and interesting and complicated patients that we have, but also make sure that you have a chance to dedicate time aside for, some type of didactics sessions, and that proper balance between learning and taking care of patients. And we don't want it to swing too far in either direction. And then, the other programs in this, which is a great foil to ours, is they have very few fellows. We have, I don't know how many, 192 total fellows.
32 fellowship programs.
Yeah. So it's just a very different environment. And so we're constantly evaluating and I want to emphasize this, in conjunction with our fellowship programs. What does that mean? And how does that change the relationship between the two? What are fellow learning opportunities? What are resident learning opportunities? When do we share learning opportunities? And so it's a continual discussion. Someone mentioned growth mindset earlier, and I think that's a principle that we definitely buy into. We never think we have everything perfect, so we're always trying to get feedback from everybody and grow into it. And I think the last thing that I'll throw out there is behavioral health is a huge, huge area in pediatrics that I don't know if anyone else has figured out. If you have, please let us know. It's something that we're definitely struggling with from an institution-wide perspective, not only just how do we train our residents in it. So I think those are the biggest areas that we're looking to continue to improve in.
I agree. I think behavioral health is a big focus for our program as well. We're actually trying to offer it as a continuity clinic option in their third year for residents, but you can choose to do a different type of continuity clinic in your third year if you choose. And so we're considering making that or making a longitudinal curriculum out of it for our residents and in that kind of Gen Peds career track. And really focusing on individualized curriculum is a bigger focus for us for the next few years as well. In addition to a little bit of continued growth with our hospital, I mentioned we're looking into expanding and creating a cardiothoracic surgical service and potentially even expanding some of our hospital area as well. And then lastly, I would say we're working to expand on our kind of wellness curriculum within regards to personal identity formation and self-resilience. So those are kind of our bigger focus here.
All right, it looks like we have 5 minutes left. So I wonder if there's maybe we should have each program go around and share any last thoughts or comments.
I can start because I don't think I've started one yet. Andrea just reminded me that one of the other things that we're trying to do is invite our residents to more formally assess our program. So we've kind of redesigned how our program evaluation committee works to focus on not just our curriculum, but also we've kind of branched it out into 3 different subcommittees where we're looking at our diversity and equity across the program. We're looking still at our curriculum, and then we're also looking at our assessment and evaluation of our faculty and our residents. And so we've invited, we've kind of, if I think about it, we've probably tripled the number of residents that are invited into those meetings with the hope that we can more accurately reflect what they're interested in and then be more responsive to them. So, but thanks everyone for giving us this opportunity. Please reach out to any of us if you have questions. I can put my email in the chat quickly. If anyone wants to reach out, please definitely do. And we hope to see some of you on the different events and the interviews soon.
Thank you very much. This was great.
So I guess I can go next. I did think of one more thing I wanted to add in regards to upcoming planned changes or future events. We're really looking at how can we best serve our residents into their future career in regards to what will that look like. Obviously, the world of medicine's changed significantly in the past 1.5 to 2 years now. And so one of those things is how can a general pediatrician really be that team care coordinator that likely that role will kind of transform and evolve into a little bit more? How does telemedicine play a role in that? And how can we help train our residents more so in that regard? And so I really would encourage anyone that has interest in those kind of things. I'm sure all programs are kind of making initiatives to advance towards those areas as well. But again, likewise, I'll put my email in the chat. Feel free to email. And I really wish you all the best of luck this interview season. I know things are very, very different and virtual interviews are ahead for everyone, but they're not as bad as they are made out to be. I will say that they actually are quite pleasant. I still would hope that one day you can go visit a program if you choose, and hopefully that will return. But virtual interviews are fantastic, and I really enjoy getting to meet a wider variety of applicants than we have ever before.
And I guess I'll finish. So for Texas Tech and Lubbock, one of the things that we are focusing on and learning more about is our diversity, equity, and inclusion. Just like all of the programs, and APPD has been really great in giving out resources and kind of guiding us. We've gotten really great ideas, and our community and advocacy faculty are just gung-ho about this, and we found we do a lot with DEI through our community block that we can enhance. And so I think it's kind of a fun time to do this because everyone's focused on it and excited about it. And so definitely we're getting more residents involved with DEI, and as the institution is as well. So I think it's just a great time for our community as well. And and I just love seeing all the faces, and I know it's on Zoom, but I hope also meeting some program directors and other people that you might be interviewing with in the future like this helps decrease your anxiety about interviews. We're all really nice.
Thank you, everyone. This has been such a great discussion, and hopefully this seems to just how incredibly loved and cared for you will be in pediatrics. You have such thoughtful program directors across, and program leadership at APDs, coordinators, chief residents across the United States who are really